Hello, and welcome to our webinar today on Avian Emergencies, First Aid for Your Pet Bird, Part 2, with Dr. Stephanie Lamb. Hi, Dr. Lamb. While we wait for people to log on, you've got some adorable feathered companions behind you. Who do we have with us today?
Hi, yeah. So today we again have Arroyo, who's been on a few of our webinars in the past. And then we also have Maureen. She's over at the other end of our tree stand there. So Arroyo is a blue front Amazon, though he is the yellow-winged blue front Amazon. So he's a variety, so he doesn't have a lot of blue on him. And then Maureen is a Congo African gray.
Nice. And they tolerate each other pretty well, is what I think yours.
Yeah, they tolerate each other okay. Like we've talked about actually in previous webinars before, where we were talking about safety, and again we'll be talking about that as follow-up for today. These two, my birds, they get along okay. I trust them to a particular extent, but at the same time, I probably wouldn't walk out of the room with them on this tree stand and have them be alone, because, they're all right, but they're not the best of friends together. So I wouldn't want anything to happen if I were to walk away. So they're okay in close observation. They've never really done anything to be a problem towards one another, but I wouldn't totally trust it. Not so much him, a little more her.
Oh, that's funny, because you've got like the stereotypical like personalities on the different spectrums there. You got the wild and crazy Amazon and the intellectual gray. So it's kind of a
exactly. They kind of fit that pretty well.
Yeah. So let's see. Let's give. I think we have a really big audience today. So I imagine we're going to have a lot of questions and a lot of things to go over. So we'll probably just dive right into it. Before we get to that though, just a reminder that if you have a question, use the Q&A button, because if you do that, we can capture your question. Don't use the chat button for questions. Use the Q&A button. And once again, we will be raffling off some great Lafeber food towards the end of the webinar. So stay with us with that. That's going to be some tropical pellets and a bag of food of your choice for your bird. All right. And with that said, Dr. Lamb, I am going to let you take it away if you want to dive into this important topic.
Yeah, so this is an extension of a talk that we had the last time we met in November, where we were discussing first aid. And that was actually even an extension from a talk that we had done prior to that about safety in our homes. So we first talked a bit about safety, about common traumas, common potential issues that we could run into in our homes with our pet birds. That then led us into discussing first aid kits and what we can do at home if we run into a problem with our pets at home before we can get to the vet. And so this is a follow-up, even from that, several questions that were asked that we weren't able to get to in the end. So this one's a little bit more of a question answer format compared to our other ones. So for anybody who didn't get a chance to watch those previous ones, I would encourage you to go to the Lafeber site and get a chance to view those, because if there's some questions that we may not answer today, hopefully they might be referenced back on those previous ones. So to just get started with those initial questions that we had, or follow-up questions that we had from the last time, one of the questions that was left over from before was, should you give a bird charcoal and baking soda if they got into something toxic? So say that your bird consumed maybe a plant that's known to be toxic in your house. Maybe they ate, for example, with the previous or the last holidays that we just had, where people have like poinsettias, and those are known to be potentially toxic and upsetting to the gastrointestinal tract of animals. Say a bird ate that. Or, what about when we have springtime coming up in a few months and we have Easter and people get lilies and those sort of things in their home? Those are known to be toxic. So what if your bird went over to one of those plants and chewed it inappropriately, thinking that it was something they could chew on, because it is natural and normal for birds to want to chew on things, particularly plant-like material. So should you give your bird charcoal or baking soda if they did consume something like that? My answer for that is no. The reason my answer for that is no is because I think it would be, unfortunately, very easy to overdo it with your bird. Yes, when you go to a veterinary hospital, if a bird did eat something toxic, one of the things that can be given, depending upon what the toxic thing was, you can sometimes give charcoal, activated charcoal, to actually, it binds toxins and prevents them from being absorbed in the gastrointestinal tract, and then it passes through the gastrointestinal tract much easier without getting absorbed and getting into the circulation and then potentially causing those toxicities that we worry about. The problem about giving charcoal at home is, oftentimes I think we have a little bit of a tendency to give more than we should of things because we get nervous and say, oh my gosh, a little bit's good, a lot's probably great. But when we give medications and charcoal to birds, we're giving them these things based off of their body weight. So it's a dosage that's actually given. And so if you give them too much charcoal, that could potentially be problematic. And if you don't give them enough charcoal, that could also be problematic because they might not then actually be getting the amount that they need in order to actually have the toxins prevented from being absorbed. So that one I'm going to say is a no. I would not recommend that. Definitely call your veterinarian. And what I would say would be a good option to have instead is to have your veterinarian's phone number, your emergency vet's phone number, and also pet poison helpline. There is a company. There's a couple of things actually. There's Pet Poison Helpline, and then there's the ASPCA Pet Poison Network that you can reach out to those people. They are staffed by veterinarians. You call them, you tell them, hey, my pet just got into whatever it was they got into that they shouldn't have. And then they're going to ask several questions like, how much does your pet weigh? Which then leads me to say you should have a scale to be able to weigh them at home. And I do have a picture, or I have an example. I don't think I showed this last time, of a gram scale. There you go. I don't think I brought it up the last time. It's good to have a gram scale at home because this allows you to weigh your bird and allows you to know, what their weight is. So then if you have to call Pet Poison Helpline for any reason, then you can tell them how much your bird weighs when you're connected with a veterinarian. And then that veterinarian that you speak with is also going to ask, well, how much did they consume? If it's something that was in a package, can you make the packaging, all that sort of stuff. So they're going to try and get as much information from you as possible regarding what it was they ate inappropriately. And then they can tell you whether or not it's something that you should give potentially something at home, or no, you need to get to the veterinarian, or hey, guess what, that wasn't something that was even toxic, so don't worry. So that is a great resource actually, is to have the pet poison hotline in your first aid kit, as opposed to just having charcoal or baking soda and not knowing how much to actually give.
And is this scale? Is that like a food? Can you buy that in the food area?
Yeah, actually, this gram scale is a food scale, which most of them are. I mean, that's kind of why most people have had them in their homes. If you don't have birds and you have a gram scale at home, it's usually because for weighing out different things when you're cooking, but they work perfectly for birds. This one just has a flat surface, but at veterinary hospitals, we tend to have ones that we make little perches for, and we set a perch up on top. So you could do that at home too if you wanted to have something for them to comfortably perch on. When I weigh my birds at home, they just stand on the flat surface and they're fine with it. But yeah, they're very easy to purchase online or get in a store. A home cooking store, home goods sort of stores would have them easily. The other thing too is the post office. Other people have them at home for weighing their mail and knowing how much to postage to put on it. So that's another good place that you can go to find those.
Oh, I think you meant bring your bird to the post office and.
Nope. I don't advise taking your bird to the post office. That might not be a good idea.
Okay.
All right. So the next question that we had from the last time was, do the person who asked, do I only need Kwik Stop or do I need a whole kit? And again, last time we were actually going over a kit and supplying it with various things that you could potentially need. Kwik Stop was one of those things. And I think Kwik Stop is a really good sort of basic essential thing to have in your first aid kit. But as we talked about at the last conversation that we had, there's many other items, including, and I brought my kit again, and actually I have a couple of kits, but that's because I'm a veterinarian. So I have my little like container. It's actually an old razor thing that I turned into a nice little first aid kit, but I liked it because it's nice and compact and easy. I can flip it open, and inside, one of my things that I have is my Kwik Stop. So Kwik Stop's great to have because, again, if you have a broken blood feather that's bleeding a little bit, if you have a broken toenail, even if you have a cracked like tip of the beak, those are all places that are safe to put Kwik Stop on. So it's a great thing to have at home to stop bleeding. You do not, again, so we said this last time, but I think it's really important to reiterate it. You do not want to put Kwik Stop on the skin, eyes, oral cavity. It's purely meant for nails. It's meant for the tip of beaks. It's meant for like the shaft of a feather. That's it. You don't want to put it anywhere on the skin or any mucous membranes, eyes, anything like that, because it actually burns. And a couple talks ago, I believe I did show a photo for you guys of a bird that had a burn from Kwik Stop. I believe it was a few lectures ago when we talked about like the safety at home, not the first aid kit. So very important to have, but I do think it's good to have other items as well. We had talked about lubricating jelly because that helps for if you have like a cloacal prolapse, something for you to put on the cloaca itself. We also talked about having various kinds of like tape that can help us for putting bandages on birds. We talked about having certain cleansers. So this is an example of, I'm sorry, it's a little bright, but of chlorhexidine, which is a great topical antiseptic that can be used. We also talked about having eye wash. So there's lots of things that you could have in your first aid kit, but if you're only going to have one thing in your first aid kit, Kwik Stop would probably be a good one thing to have in the first aid kit because, oh, and Maureen, I don't know if you heard her, she just said yeah, so she agrees that Kwik Stop is the good one thing to have if you're only going to have one thing in your first aid kit because it helps to stop bleeding. So now, I mentioned the ointments, and actually that was also the next question, or the lubricating jelly is the next question. They asked if there's any specifics about the lubricating jelly. And so usually I just would tell people to get like the non-spermicidal sterile lubricating jelly. You want it to be sterile, which they should be, but good to have that confirmed on the label that it is a sterile lubricating jelly. And again, the reason for lubricating jelly is because if you have a bird that has something like a cloacal prolapse, which is where, just a quick anatomy lesson on birds, they have just a single opening, the vent, where both feces, reproductive, and urinary materials all come out through that one single opening, the vent. Fecal material, urinary material, reproductive material all empty first into the cloaca, which is the common excretory organ, and then the vent opens and stuff comes out of the cloaca. Occasionally, you do have birds that have cloacal prolapses where that common excretory organ pops out the vent, and you have this big red thing that looks like a cherry hanging off the end of a bird. If that happens, definitely you need to get to the vet, but having lubricating jelly available is going to be good because that allows you to put that sterile lubricating jelly on the end of that cloaca, because normally the cloaca is a very moist organ, and if it is exposed to a dry external environment, then it could dry out, it could get damaged, it could be irritated, you could get secondary infections. So putting a little sterile lubricating jelly on it just keeps that moisture nice and present for the bird, so that you can then get to the vet, and then the vet is able to do what they need to do to replace that cloacal prolapse. The next question was creams versus ointments. What's better? There's lots of different products out there of different creams and different ointments. The thing to know about the difference between cream and ointment, first off, is how much oil is actually in the product. So with creams, there's not as much oil as there is in ointments. Ointments have a pretty high oil percentage, whereas the creams have a much lower percentage of oil, and some creams I don't know if they're going to have any potentially. But it's a very sort of broad question to ask if creams are better than ointments or ointments are better than creams, because it really depends on what the product is that you're using it for. So that's something that's going to depend on what you really need the product for. You know, in certain situations, creams may be better on the skin for injuries, but in other situations, an ointment might be better if you have like a deep wound and you're just kind of covering it with something temporarily, making sure that nothing gets into it to contaminate it. So that's a little hard question to answer because they're good in their own individual ways. I guess I would have to say, as just sort of as broad as I possibly can be with that question, is creams are going to be better for maybe more superficial things, and ointments may be better for more deep wounds and just temporary until you can get to the vet, just something to cover it up to keep it from drying out or getting contaminated in any way. All right, so the next question that I had on here was, can a African gray drink warm water? The answer is yes, that's completely fine. I'm not sure the exact reason behind that question, but the answer is yes, it is okay for an African gray to drink warm water. I wouldn't want it to be too hot, just like for us, you know, if you're drinking a hot tea or coffee or some other hot beverage, you know, you have the potential to cause burns, same thing. You know, birds are not at any less risk for burns from hot drinks. So warm water is completely fine for them, but nothing too hot. Okay, oh, the other question that we had was, what if bone is exposed? So say an injury occurs at home, and unfortunately, that injury has led to bone actually breaking through the skin and being exposed. What should you do in those situations? Well, in those situations, excuse me, we had talked about last time sort of about the layers of wrapping a wound. If there's bone exposed, that's where you might want to put something like some sort of moist covering over that exposed area, because we don't want that bone or muscle, the tissue that's been damaged, to get dried out. So a little bit of ointment sort of over that wound initially, and then you can put several layers over the wound to make yourself a bandage. So again, first you put your sort of moisturizing cover, and then you can put like a little piece of gauze initially over a bone, just so that gauze isn't really going to be sticking so much to any wounds. And then you can get your little cast padding roll that we talked about before, and you can kind of wrap that around. And then you can do your third layer of your vet wrap, where you wrap that then around to just keep something nice and secured and safe. So the three layers really is whatever is covering your wound first, then you have your gauze, and then you have your cast padding, which is just this nice soft sort of compression bandage a little bit, but also makes it so that when you put your vet wrap on, you're not putting that vet wrap on too tight. But if bone is exposed, you really want to get to the vet as soon as you possibly can. So you might be putting that wrap on just to lightly be covering the area as a temporary fix. Again, like we talked about last time, a bandage, if applied inappropriately, or if a bandage is applied inappropriately, it could do more harm than good. So if you're not sure, better to just, probably not put a bandage on, take the bird to the vet as soon as possible. If you can't get to the vet right away, then that's where putting a little bit of covering over that wound is going to be helpful to prevent contamination of the wound, to prevent the bird from bothering the wound, and then also to allow stabilization. So it's not moving too much and being uncomfortable for the bird. Next question that we had is, what type of tape is used for wing wraps? Now, there's lots of different types of tapes that are out there. And again, since the whole point of us talking about the bandaging is more just these sort of temporary bandages to keep the bird comfortable and before we can get to the vet, and then allowing the vet to put the more appropriate bandage on that is required for whatever that particular wound is, because depending upon where the wound is really determines what type of bandage needs to be placed. But if we are temporarily putting a bandage on a bird, the type of tapes that are appropriate, this paper tape, it is very gentle, and it is actually, there was a study that was recently done that looked at tapes on feathers and how they affect feathers, if they can lead to feather damage. And the paper tapes was actually shown to be the least damaging to feathers. Now, I will say paper tape is a little bit flimsy, but again, it's just a temporary thing. So if we have a wing wrap that we want to put on a bird just as a temporary thing, then the paper tape is okay, because it's very non-damaging to the feathers. It's has a very hard ability to actually lead to compression or anything like that. And it's, again, just temporary. But there are also plastic tapes that can be used. And then there are like the cloth tapes as well that can be used. So, but for home, again, as a temporary thing, the paper tape's a good one to use. Let's see. Next question that I had on here is, can you make homemade saline solution for eyes and wounds? You know, there are solutions that you can make at home, and there's instructions that you can follow from books or from saline solutions you can find online. Typically, they are going to involve boiling water so that you are essentially sterilizing that water, and then putting a certain amount of salt in with that water to a particular ratio. So yes, you can. You have to do it right, with the most important part being that you are boiling that water so that you are killing any pathogens. You're then placing things into appropriately cleaned or sterilized containers for storage. If your plan was to make this saline and then use it soon after being made, you definitely need to make sure that it's cooled down appropriately. You could use thermometers to assess the temperature to make sure that it's not too hot if you're going to be using it for wound cleansing. So that's where you have to be a bit careful, is the sterility, and if you're using it quickly, not making sure that you're using it too hot after you have boiled it to sterilize it. So that being said, getting things like eye wash solutions are easy. There's different types of solutions. There are ones that are saline, and then there's ones that are purified water. The one that I have here is a purified water one. And they do have expiration dates of how long they're going to be good for inside of the bottle. So if you want to be, really certain that you are using something that is the appropriate isotonic fluids, because that's what we say, and making sure that they are not too salty or not salty enough, purchasing a product is acceptable as well. Okay, next thing. Should you have a syringe available? Well, I think having a syringe for medications is a great thing to have available, because you can use syringes for medication administration, for fluid administration, assist feeding administration. I have an example of a syringe sitting right here. It actually has a little bit of grape juice actually in it right now because we're going to use it as a demo. But having little syringes from your veterinarian available and in your kit is a great thing to have. I definitely have a few in my kit, and if you can get them from your veterinarian, then it is a good thing to have available. Next question. For liquids for a day, do you subtract the amount of liquid in feeding formula for a fluid amount? Okay, so we had talked about like different amounts of fluid. So if you reference back to previous talks that we had given about the safety talk and the first aid kit talk, we did discuss volumes of feeding that could be given on a daily basis for an anorexic bird. And we also talked about fluids that could be given on a daily basis for a bird that isn't drinking. And so I think the question is in relation to, well, if you're making like a liquid diet and you're giving them that liquid diet, the amount of fluids that you're putting into that liquid diet, does that then take away from their daily fluid amount that they need if they were not eating a liquid diet? And I would say that yes, that is the case, that the amount of fluids that you are putting into that assist feeding formula to make it sort of that liquid diet can be subtracted from their daily fluid amount that you are having to potentially syringe feed them as well if you have a bird that's completely anorexic, that's not wanting to eat and not wanting to drink. So, you know, that's something also that brings up the point that when people are syringe feeding their birds, one of the things or questions that I get a lot is, well, he's taking the syringe feeding really well, but he's not really drinking now, and he was drinking fine beforehand. And then I always let them know, well, because you're using the syringe feeding formula, he's getting his fluids that way, so he feels like he's getting enough hydration, so it's okay that he's not drinking as much as he normally would, as long as you're hitting that daily amount of fluids that he should be getting. All right, the next question that I had, can you use flour to stop a bleeding nail or a blood feather? Oh, I should have gone over that when we were going over the styptic powder. Yeah, you can. You can use flour to stop a bleeding nail or a bleeding blood feather. I would say it's not as effective as the Kwik Stop. The Kwik Stop does tend to be a little bit more, it's better at actually staunching the bleeding. The other thing that's nice about Kwik Stop is that a lot of the Kwik Stops actually have benzocaine in them, and benzocaine has a analgesic property to it. So you're getting the benefit of stopping bleeding, but then you're also getting the benefit for, like, say if you have a crack on a beak or a crack on a toenail, those can be painful and uncomfortable. The broken blood feathers, not so much, because the broken blood feathers, you know, they there's no innervation inside of the feather itself when that feather is broken, so that one doesn't matter so much about discomfort from the actual break in the feather itself. But with a break in the nail or break in the beak, there is innervation to those tissues, and so those have the potential to be a little more uncomfortable. Just so that we don't cause any
You might have to break out the kit then.
Right, I have my kit right here, but we don't want to use that. We want to always avoid. It's much better to avoid things than to have to treat them. So since Arroyo was wanting to get a little close, we'll move him out of the way. But anyways, so back to the Kwik Stop versus using flour. It's okay to use flour, but the Kwik Stop is just going to be a little bit more effective for you and for pain relief. All right, so the next question I had was also a styptic powder question. And the question is, do you have to wipe the styptic off to prevent ingestion? And the answer is no. I mean, honestly, the amount that you put on, once you put that styptic powder on there, like it interacts with the blood, forms a little clot, and then it just stays there. And so any dry styptic powder just falls right off. So you often get more, honestly, more styptic powder on the ground and around you than actually on the bird itself. So the amount that's necessary to stop the bleeding is all that is going to be present on there. I honestly can't think of any birds that I've had that have taken the styptic powder off their toenails, but I will say that it's probably because when I'm placing styptic powder on most birds, I'm holding them for a moment. And we're placing it and we're letting it sit and we're letting it clot and we're giving it a moment. And honestly, that moment of pressure that's applied as well is also just as important as putting the powder on itself, because that pressure is also helping the whole clotting process. So by the time that we then set the bird down, when we feel safe saying, okay, it's clotted appropriately, everything looks good. By the time we've put the bird down, a lot of times at that point, the bird is like, okay, I'm gonna go, back into my cage or back to see my parents and just kind of hang out with them and relax. So I certainly have had birds after they're a little more calm and relaxed and everything is feeling more comfortable for them. I have had them then like lift their toe up and like then sometimes like feel things, but I can't think of any that I've ever had them actually break the clot off and have it start bleeding again. So, and if they did and they ingested that little bit of styptic powder, it's so insubstantial that it wouldn't be a problem. Because I think that was really the point of that question is it safe if they get it in their mouth? And the answer is that, yeah, it's okay. Because even when I use it on the tips of beaks, I've had maybe like a tiny bit of the powder get into the mouth, nothing substantial and no issues from that teeny tiny bit. Oh, the next question is also styptic powder related. We got a lot of them together. That's good. The question was, do you apply styptic powder with a Q-tip? And sometimes I do, and sometimes I don't. It kind of depends. One thing that I have done a lot that I like is the styptic powder. A lot of times I will actually take the bottle, open it up and take the cap and pour some of it into the top of the cap here. And then I just basically hold the bird's nail up into that and have them apply it that way. There have been plenty of times where I have applied it to a Q-tip. If you apply it to a Q-tip, what I would recommend, that seems to help make it stick to the Q-tip better, because if you just put it on the Q-tip, again, it's this dry substance, so it's kind of like falls off a little bit. If you get your Q-tip wet, and then you put the Q-tip into the styptic powder, some of that styptic powder will stick to it, but then also more of the dry stuff will stick on, and then you can apply it a little bit easier. So that's just my tip. If you do choose to use a Q-tip, get your Q-tip wet, stick it in the styptic powder, then stick it to wherever you need to, whether it's tip of the beak, a feather, or a toenail. It'll just make you happier, because otherwise it'll fall off the Q-tip and you'll just be annoyed.
And then just make sure your bird doesn't take the Q-tip and play with it.
Right, yeah, then exactly. Okay, another question that we had, getting off the styptic powder questions at this point. What do you do if you have a bird aspirate? That one's a difficult one because it depends on how much they actually aspirate. Most of the time, the first thing I'm doing is setting that bird down, because if a bird aspirates, the majority of the time that it's been a problem is not when the bird is doing something, it's when someone's giving an oral medication and you're putting something in the bird's mouth that the bird wasn't really wanting or wasn't ready to swallow, or maybe you put too much. Sometimes if you're new to working with a syringe, sometimes you don't realize how much pressure you have to put on the end. You might squirt too much stuff in all at once and then they aspirate a little bit. First thing to do, set the bird down. Because if you set the bird down, that allows the bird to cough. The bird can cough, it can get anything out, it can shake its head. It's then in control of its body and what it needs to do to expel anything that it aspirated. If you sit there and hold it a little longer, then it's not really able to shake its head or like cough the way that it really needs to, if you're holding it in a funny position. So number one thing is put them down and let them cough. Let them, I know it's hard to watch a bird to do something like that, but there's not much that you can do holding it. If it's a substantial amount that has been aspirated, you could always potentially tip the bird so that the head is angled down and the body is angled up, so that you're allowing gravity to help things flow down more appropriately. But really one of the best things is allow them to cough. Set them down and allow them to cough and let them get their bearings. I will say that most of the time when a bird does aspirate a little bit of medication, it's not a substantial amount to cause a problem. Typically when a bird aspirates a little bit of medication, it's a tiny amount, it's irritating, they don't like it, they get upset by it. It's just like if we accidentally swallow water the wrong way, you know, it doesn't feel comfortable, you may get a little burn in your throat, but you're okay. You know, we have mechanisms within our trachea that if it feels irritated from something being in there that's not supposed to be in there, we cough. You know, it's a great evolutionary mechanism that us and other animals have the ability to do. And so just being able to cough is an important thing. Just let them cough it up. The one thing I would say that's probably been more of a problem with aspiration, because medications tend to be small volumes, food tends to be a little thick, so it's easy for them to cough things out. Sort of different story if it's a baby. I would say more commonly in an adult bird, if we're dealing with a bird who is sick, more commonly it's when people give water inappropriately, because again, sometimes it's squirting a little too much water in too rapidly. The important thing is to just sort of dribble small amounts in to their mouth and let them go through the process of licking and swallowing, so that they are, you know, not having their glottis, which is the opening to the trachea, open at the moment when you do squirt something in and then they aspirate.
Dr. Lamb, quick question about aspiration. If you have a syringe and you're putting in your bird's beak, which direction is the side of the, does it?
Great question. So generally speaking, we usually tell people to go to the right side of the bird. The reason for that is their crop, like though the esophagus and the crop is pretty central, it's just a little bit shifted to the right. And so when you're putting a syringe in the mouth, you want that tip to be angled towards the right. And actually, I can show you guys now. The reason I had Maureen with us today, the Royal just wanted to come just because he likes the attention. But the reason I had Maureen with us today is because she's a really good bird to demonstrate how to give medications to. And there was one other question as well about how to appropriately handle them for any sort of restraint, and she's really good for that as well. A little history on Maureen. Maureen has seizures and she has to get medications 3 times a day. And so with having to give her 3 times a day medications for the last, I think she's been on her 3 times a day medication since 2015. So, you know, she's been on this for over about 5 years, essentially, at this point, a little more. She's had to get used to taking medications and being handled and having a syringe in her mouth. And so she's actually adapted really, really, really well, and is a fabulous bird for being allowed to be restrained. So I'm going to pick her up and I'm going to show you guys what it is that we do, how we are holding them when we are restraining them. And I'm actually going to restrain her without a towel, because then you can kind of see where my hands are placed easier. And plus she's pretty good without a towel. So I like to do things as low stress as possible. So with her, I'm not going to use a towel. Now, if I had to do something with Arroyo, I would use a towel, because Arroyo is not getting medications 3 times a day. He's not as used to me having to restrain him. And when I do restrain him, he's not really into it. It's just, he doesn't like it. So he's a little more wiggly and moves around quite a bit. And so having a towel is nice, because with him, if I have to restrain him, getting a towel to keep those wings in, because otherwise he's like putting his wings all over the place and he's just a crazy little guy. we'll put the towel around, it tucks those wings in, and then it just makes it so that, okay, now I'm kind of more contained. I can't flap my wings as much, so I'm less likely to do something silly and get myself hurt. So, but with Maureen, she's not a towel bird. So let me get her really quick. Maureen, can you step up? Good girl. So, and she's even like getting ready to do it, because she does a little trick before she actually is restrained. And with a patient or a bird that you have to do this with a lot, it is really good to train them to get used to taking medications or getting restrained, because it's just so much lower stress on them, and they just have a lot happier life when they are not having to be stressed by taking medications or doing things that maybe they don't want to do. So with Maureen, what I always do with her is I tell her it's time for your medication. And I kind of angle my hand just ever so slightly differently when I say that. And so she actually does this thing where she falls back, and she chose to do that. So when people see it, they're like, why did you teach her that? It's just what she wanted to do. And then I kind of come underneath her and scoop her up. So, all right, Maureen, it's time for your medication.
Oh my goodness.
So she falls back, and that's just our routine. And so you can see what I do with her is I'm holding her such that my hand is around her neck. Now I'm not compressing her neck. And if you see where my fingers actually are, I'm going to get her close to the screen here. You can see I have my index finger and my thumb on either side of her jaw. And so I'm actually not really putting any pressure around her neck. You can see that it's open on the side there, that my fingers are not completely touching one another. And I'm just putting pressure on her mandible so that she is comfortable, but I'm also safe, so that I'm not getting bit by her, and I'm able to do what it is I need to do. The other thing that I'm doing, you'll see, is I have her holding my hand. Birds like to hold on to something when you are restraining them. And so allowing them to hold your hand is going to allow her to feel a whole lot more comfortable and be able to sit here while I talk to you guys and not be upset about this whole thing. Now, I am going to give her a little bit of this juice right now as a way to show you guys how to give medication, but then also give her a little reward because she's being such a good girl. Right now she's telling me I'm kind of done. So what I do with her is I then often will kind of just rest her feet on my chest, just because now she still has something to hold on to, and my other hand is free so that I can take the medications. I take the syringe, I hold it up to her mouth. Though I am coming in on her left side, I am angling towards her right. She knows that I'm going to give her something. She's opening her mouth, and I angle towards that right, and I just administer it, and then she's done. And then I let her go. And so she was a great demo bird. She was really, you'd like your cherry juice there? Good girl. All right, I'm going to set her back. So, but I hope that allows you to see where my hands are placed, which is really important, because a lot of times when people haven't seen a bird be restrained before, when they see me put my hand around their neck, they think, oh my God, you're choking my bird. And I'm not. And just to explain it again from, I believe we talked about it the last time, but with our trachea, our windpipe, we have these C-shaped rings of cartilage that hold that trachea open. If someone comes and like grabs our neck and chokes us, you can kind of compress those C-shaped rings and have a whole lot less diameter in that area for airflow. In birds, they already have complete tracheal rings. So compressing them is not really going to allow for that. If you wrap your hands around there, it's not going to allow for compression because those C-shaped rings are holding a lot more stability to that trachea. Again, I'm putting my hands on the side of the mandible there, not around there. And it's just allowing me to allow her to have gentle pressure at that spot so that I can keep her from being able to bite me, which is very important, because if I can't handle a bird appropriately, then I'm not going to be able to do anything helpful for that bird. So I need to be able to handle that bird appropriately so I don't get injured and so she doesn't get injured. The other thing that's really important about that handhold, because sometimes people go, well, why don't you just hold them around the chest? You do not want to hold a bird around the chest when you are restraining it. The reason you do not want to hold a bird around the chest when you're restraining it is because they breathe a little differently than we do. We have a diaphragm that separates our chest and our abdomen. They do not have a diaphragm. They just have what's called a coelomic cavity. And in order for them to have normal respirations, they need to be able to actually expand that keel bone. So that big breastbone that they have right in the front there, that needs to be able to move in and out. And if you compress over that, you're compressing their ability to breathe in and out. And if you're compressing their ability to breathe in and out, then that's could be deadly for a bird. So holding them around the neck, hands rested on the mandible. And then if you also saw, the back of my hand was kind of against her back. So that's just allowing a little bit more stability when her back is against my hand. And then again, I have her feet able to hold on to something. If I had her feet just up in the air doing whatever she wanted to do, she'd be scared. She doesn't have anything to hold on to. She wants to have something to have stability. So allowing a bird to hold on to something, whether that's just the towel, your finger, something to just give them some stability is going to make them much more comfortable, much better for you while you are having to restrain them when you're doing whatever it is that you need to do to work with them to administer first aid, whether that's giving some fluids, assist feeding, medication, or you're placing a bandage on them or putting some styptic powder on. You know, appropriate restraint is going to go so far to help you. And then the last question that I had from last time before we can go into any new questions that we have is, how do you treat burns? All right. So burns are a very special topic. And the reason they're a special topic is because just as like people have different degrees with burns, I mean, same thing with burns, 1st degree, 2nd degree, 3rd degree burns. And burns can be really quite damaging and deadly. You know, a bird may be able to survive the initial incident of getting burned, but then as the days go by, if not treated appropriately, and even sometimes if they are treated appropriately, they can sometimes still pass away from burns, just like it can happen in people with really severe burns, unfortunately. Burns, you know, you're damaging tissue, you're exposing subcutaneous muscle, potentially bone tissues that are not supposed to be exposed. If you have a large area that's of exposed tissue, it's easy to become dehydrated, get secondary infections, electrolyte imbalances. I mean, there's just a whole list of things that can happen with burns. So answering the question of how do you treat burns, it depends on the severity, but I will say generally, it's going to be wound cleansing, keeping those burns moist at certain stages in their healing phase, keeping them covered, treating pain, getting them on antibiotics. So there's quite a bit of involvement at home. I would say put some ointment or some cream over it, cover it, get them to the vet. Because at the vet, then they're going to be able to assess how severe is this? Does this bird need to stay in the hospital for a few days and get IV fluids, subcutaneous fluids, you know, what sort of antibiotics are going to be necessary, pain relievers, all that sort of stuff. So that one definitely involves quite a bit of work with a veterinarian to know exactly how much care is needed. So
Dr. Lamb, a quick question about burns. I imagine a good deal of burns have to do with feet because birds landing on hot surfaces. So if your bird, like say, landed on the stovetop or hot food that you just had, would you have to take consideration on where you place them afterwards, like on a perch or on a flat surface or on a damp towel? I mean, something that's gonna.
Yeah, that's a great question. I would say a flat surface, honestly, is probably going to be the nicest thing for that bird's feet. And I would make sure, of course, that it's either, you would want something that's able to stay clean easily. You wouldn't want them to be placed on any sort of like paper bedding, wood bedding, you know, that sort of stuff. Now, a piece of newspaper as a single sheet of paper, perfect. A towel, fine. But you just wouldn't want something that's like little bits of like fibrous material or anything like that, you know, like some of the pet bedding that's used for like baby birds or small mammals, that sort of stuff, because you don't want those little particulate matter things getting stuck in there. So just regular, you know, paper or, like I said, a towel is fine. As far as like wet versus dry, it kind of depend on the severity. you know, I'd probably would just be more apt to say, just put some ointment or some cream on the feet, and then get them in, as opposed to having them sit on a moist towel. I would just worry a little bit about like thermoregulation problems if they're sitting on a moist towel for too long, because, you know, some people are pretty far from their veterinarian. Maybe they have to drive a couple of hours to get to their vet. Hopefully not, but you know, that is the case for some people. And if we have a bird sitting on a wet towel for a couple of hours and they have burns, I could see that turning into a problem where they get too cooled, and then we have another problem on our hands. So probably ointments and creams, and then a dry surface.
Okay. So are we good with the, we got all those questions?
Those were all the questions that I had from the last time. So any new questions that people have, I'm ready to take those.
Okay, so our first one comes from Christine. She says, you recommended triple antibiotic ointment for the first aid kit. Is cream okay to use instead? We already have it. Or does it not provide enough moisture for the wound? Are there any special recommendations for first aid kits for senior birds? She has 2 male lovebirds and that are 13 and 14 years old.
Oh, nice. So if you have the triple antibiotic ointment, I mean, that's a very basic, easy ointment to have. So I would keep that. If I had to have one sort of topical thing, it would be triple antibiotic, and I probably would go with the ointment. The difference between the creams and ointments, I guess, also is more like, how often are you going to be using them? If I'm going to be using something on the skin that I need to be applying several days in a row, I'm probably going to be going with a cream. But if I'm just using it temporarily, again, for this sort of first aid moment in time where I'm just stabilizing things, an ointment is totally, it's fine. Oh, and then the special thing for senior birds.
Yeah.
I can't think of anything special for senior birds that would be needed in a first aid kit. I guess, you know, I don't remember how much we talked about it last time, but we did talk about assist feeding. I know we talked about it and talked about the amounts and things, but, you know, having assist feeding formula available is a good thing. And Lafeber's does have a product called Omnivore Care that is sold specifically to veterinarians, that if your veterinarian sees birds, they probably have it, because it's like the only one out there and it's the best. So, you know, if you go to your veterinarian, even for wellness visits, and just ask them, hey, is it okay if I have some, it's called Omnivore Care, Omnivore Care product, so that I can have it at home for first aid needs should I ever need it. I think most veterinarians would say yeah to that, because it's a good thing to have at home. So not necessarily specific to older birds, but any bird could have it.
Okay, so then Paige wants to know, she said, how would you go about restraining a more reactive bird? Would you do things differently? So
yeah, I mean, so Maureen's great because, again, I give her medications 3 times a day and for many years, so she knows the drill. She's really good about being restrained. And there's other individuals that maybe haven't been restrained before that would be equally as good as her. It just depends on the individual bird, but there's definitely birds out there that are not good about being restrained. And honestly, Arroyo is one of those birds he's okay, but it's not his thing. He's not into it. He doesn't like it. He gets upset when I have to restrain him. And so for those birds that are a little bit more reactive, a towel, again, is your friend. A towel is really helpful to have, because a towel allows you to easily drape. You drape the towel over the bird and then you can pick them up. I don't want to do it to Arroyo because I don't want to make him upset, because I like to keep him happy. But I do have a towel, and I do have a Lego African gray. And so say this is my African gray and it's being crazy and running all over the place and not wanting to be restrained. A lot of times I will have the bird down on the ground, and I may have them go into a corner just because it's easier in a corner, less roots for them to potentially escape from. And essentially, when they're in that corner, then what we do is we just drape over them, and then I'm able to pick up again at those pressure points from behind. So sometimes they will be okay with you completely draping it over them, and then you just have to know where their head is. Again, grab around the neck, and then you can have their little head come out, and then they can see what's going on. So a towel is definitely your friend if you have a bird who is not as.
Can you do? Could it be bad if, I mean, if your bird's just showing obvious signs of being overly stressed by trying to be toweled? Like, should you take a break if the bird is?
Oh yeah, absolutely. If the bird is looking overly stressed, absolutely take a break. You don't want to stress them to the point where they're panting and truly upset. They may get a little hot in the towel. I will say that is normal. There's a lot of times where when they're in the towel, they get a little warm. You take them out of the towel and they may pant for a moment after being in a towel. Don't be too worried if you see that. That is something that can happen just because, hey, I'm a little nervous, I'm a little worked up, and now I'm inside of this towel. As long as after they've been released from a towel, they are their panting stops in a couple of minutes, then it's okay. It was just they got a little worked up, but don't worry about it. If you have a bird that's really worked up beforehand and they're panting and they're just, flying all over the place, or flying into corners, walls, windows, anything like that, that's a bird that, okay, maybe let's hold off, let's give them a break. And sometimes, honestly, trying a smaller space to get them from. Sometimes a carrier, if you have a bird inside of a carrier, sometimes it's easier to get them from the carrier because then you just move into the carrier with the towel, gently wrap it around them, and then pick them up and bring them out. If you're in your home, if you can go into a smaller room like a bathroom or a closet, something that's just smaller space so that they can, again, not have as much ability to get away, fly around, and potentially hurt themselves. I have heard of times where people have tried to catch a bird got really scared and flew into a window and got hurt, so it is definitely a risk, and you have to watch your bird closely. But the other thing I will say that's really good is training them. And training takes time. It's not something that you're going to get done in a short period. But if you train them to maybe be comfortable with the towel, if you drape the towel, get the towel close to them, drape it close to them, give them treats, positive reinforcement, clicker training. I mean, there's a lot of great resources out there for training your bird. And the only reason Arroyo is probably not so great is because I honestly haven't worked on training with him. So I've got room for improvement with that, and if your bird is trained to be able to be okay and comfortable in a towel, it's going to go a long way to keeping them comfortable when it comes to times of having to go to the vet or some emergency does happen and you have to pick them up.
Okay. And then Ariel asks, what do you recommend if your bird is choking, like a nut is stuck in the trachea? Is that is that something that you've seen?
Well, I've never had a bird choke with a nut. Very, very, very rarely, but it is reported and it can happen, is cockatiels, usually, with seed aspiration. And honestly, the best thing is get to the vet as soon as you possibly can, because those situations, if a little seed or something gets stuck in the trachea, what's happening is, like, if this is my trachea and I have this little thing gets stuck inside of there, you can just see that, okay, maybe some air can still pass by because there's that little bit of space up there, but it's definitely not that much amount, right? So they're definitely going to be working harder to breathe. A complete obstruction, I mean, that can be life-threatening very quickly. But most of the time it's not. Most of the time it's something that is in the way, and you just need to get to the vet as quickly as possible, because to unlodge those things, oftentimes they first need what's called an air sac tube placed, where the nice thing about birds is they have their lungs and then they have their air sacs that branch off of their lungs. And so you can actually place a tube into the side of their body to allow them to breathe from the side of their body, which mammals, like, that's not even a thing. So that's the nice thing about birds. And so sometimes they need those air sac tubes placed rapidly in an emergency situation so they can breathe suddenly, and then we can work on getting that little thing out of their throat. I mean, and those situations, get to the nearest emergency vet that you possibly can. Every veterinarian has oxygen, and just getting them to sit and relax in oxygen first is a huge part of helping that situation.
Wow. And what would be the sign that you would know your bird's choking? I mean, with people, it seems more obvious, but with a bird, would they be trying to regurgitate? Or
yeah, they're often trying to like throw up. They're suddenly in distress. Everything was fine, and then suddenly they're in distress. They're shaking their head a lot is typically what you'll see, is they're just like flinging their head around. They may actually be spitting whatever was in their crop out because they're just trying to like bring things up. And then just when they do relax, you're going to see them working harder, whether it's their chest that's moving, or if they're sitting on a perch, you're going to see their tail bobbing. Because if you see a bird sitting on a perch and its tail is bobbing up and down, that means it's working hard to breathe. And so you might see that in those situations.
Okay, well, that's good to know, because yeah, it seems like an emergency, because you're not normally like sitting and eating with your bird, so you wouldn't necessarily see the choking going on. So.
And I will say, just to help ease some people's fears, whenever I have had that happen before, whenever I have had a bird that is actually choking, the owners have always been able to get in. The bird may be in a debilitated state, but I have seen them be able to get into the hospital, you know, so you have a little bit of time typically.
Great. I think, gosh, you know, we went through a lot of questions and we still have more, but that's all we have time for today. If we didn't get to your question, you know, we'll get to it. We'll try to, maybe another session of this, we'll go with Dr. Lamb, or we'll email you an answer if you sent your question through the webinar Q&A button. So those are some fantastic knowledge that people should have to keep their birds safe. So thank you, Dr. Lamb. Totally good knowledge to have heading into the new year, especially. I think, you know, we can always learn more and more about what to do in a case of emergency. So then when something does happen, we're probably a little bit calmer because we've been through, you know, the studying part of it. So,
exactly. Yeah. When you have the knowledge, you know, it's helpful to keep you calm. So
I have to announce our winner for today. So today's winner of our raffle for the tropical fruit pellets and a bag of Lafeber for food of your bird's choice. Our winner today is, oh gosh, where did he go? Donald W. So congratulations, Donald. Lafeber office will be contacting you via email for your mailing address and what the type of bird that you have and what other Lafeber product you want. So that was fantastic questions. So thank you everybody who logged in, and just to also point out that we do have our webinars recorded on the Lafeber YouTube page. So you can watch this webinar, the previous first aid webinar, and every other webinar that we've hosted, which, by the way, we have a lot of Dr. Lamb on our webinars. You are like our pioneer webinar vet here. So thank you for all the time that you've given the Lafeber audience. And next Friday, we have another great webinar. We have Chris Davis. She's going to do another, we did one with her before, but we're gonna do another heart-to-heart kind of bird talk former column, heart-to-heart with Chris next Friday at 12 p.m. Pacific Standard Time. So check the lafeber.com for our webinar schedule. In the meantime, Dr. Lamb, thank you once again. Thank you, Marie. Thank you to the birds.
Yeah.
They've been very good. Arroyo really wants to interact with Maureen. I can tell Maureen's not giving him the time to answer. So anyways, so everybody, thank you so much. In the meantime, everyone be safe and all the best to you and your flock. Bye.
Bye.